Hi Redditors and friends, it's Sunday, July 19th. I've got a bucket of updates for you both from a daily perspective and from a weekly perspective. So let's go ahead and dive right into today's report. Today what we saw was, I don't want to call it an average Sunday because it was up from what we saw for last Sunday, but just to set expectations on Sundays, we typically see lower reporting than the rest of the week. What drives that is a lot of this reporting comes from county health departments, and they just aren't open. So you'll see only 5 deaths were reported as an example. That doesn't mean only 5 people died. It just means that we saw only 5 reports today. So just want to make sure that's clear as we go forward. Tests, we did see 10% more tests than last week, so that is a good thing. Test and case results typically come in electronically, so there's not that kind of manual reporting lag than with deaths and other reports. Tests were up 10%. We had a 14% positive rate, which means we had 3,200 cases reported today. That's up 700 from last week, about 20%. So things are still rising and climbing. I wouldn't say, wow, we're down from yesterday. It's great. It's Sunday, and we don't see the same volume of numbers. People don't get tested. Doctors' offices aren't open, those kind of things. So definitely not a number to declare victory on by any means. Moving to the hospitalizations, interesting milestone here. GEMA reports that we now have 3,000 and what's the exact number? 3,036 active hospital beds in use for COVID-19. We passed the 2,000 mark just 13 days ago. We passed the 1,000 mark 28 days ago. So in the last 4 weeks, we have added about 250 hospital beds a week. No, 500 hospital beds a week for the last 4 weeks in order to get to this number. So definitely continuing to see that hospitalization number climb. Let's go ahead to the CCU numbers. You see we've got 5 in CCU status of 90% or higher. We have new on the list today is the Athens region. They added 7 beds in use yesterday, which dropped their capacity down to only 5 remaining, putting them at 93%. Falling off the list today was Region I, the Columbus area. They now have 12 beds available, so they are at 88%. Still staying on the list is the Central Region, Macon area. We've got the Oconee area, that's Milledgeville, and that central part of the state at 90%. Down on the shoreline, we are still at 93%. And then Northwest Metro, Kennestone is at 95%. Had a few questions about where are the beds that are being put into the Georgia World Congress Center. Right now, we haven't seen them come online as CCU beds. Don't know. I think I've seen them called diversion beds, which means they will be used for things other than COVID-19 or COVID-19 CCU. For example, somebody breaks a leg, needs to be in traction. That's the kind of bed that would be used, from what I understand from my reading. But we'll keep an eye on if those come online. We will let you know. All right, so that's the daily numbers. I want to jump in and show you the weekly numbers as well. Right now, from a testing perspective, we have seen testing climb. And this is a good thing. Everybody says we need more testing. We have seen testing climb the last 7 weeks. We're doing more than 25,000 tests a day, and we expect to have another 10,000 additional capacity come online in the next couple of weeks, according to Governor Kemp from his Friday press conference. So that would be a good thing. Test volumes have increased 7 of the last 8 weeks. They didn't increase the week of the 12th, but I'm wondering if there's some hangover there from 4th of July holiday, that might be where we look, because those are week ending dates, and it just may be where that played out there. When we look at cases, cases are up on a 7-week growth trend as well. We averaged 3,700 new reports per day this week. So we hit 28,000 new cases this week. Put that in perspective, out of every 5 cases Georgia has had for COVID-19, one of them was diagnosed last week. So it really has been a huge run on COVID diagnoses in the last few weeks. We are definitely hitting a spike. As far as hospitalizations go, we actually, another perspective kind of message, we hospitalized about 10 people an hour for COVID-19 this week. That's definitely a high number, and we talked about the CCU and the bed capacity, so I won't go into more there. The active hospitalizations, that purple trend that I show on the daily chart, that went up by 74 a day. Deaths, we are on a 3-week growth trend on deaths, unfortunately. We passed the threshold of 1 death an hour from COVID-19, but right now we have seen worse days for deaths. I know people are saying that, deaths are a trailing indicator. We won't see them as much. We'll have to wait and see how that goes. The other side of that is younger people are getting infected more. They may not be as impacted. It may not be as deadly for young people. So the only thing that's going to tell us the answer to this right now is time. So we will keep an eye open and watch for what happens there. All right, that's the daily and weekly update for everybody. Keep in mind that we can discuss this, and lots of people do, on the coronavirus GA subreddit over on Reddit. So come on over. I'm there. I answer any questions about numbers that people have, and as they spark information or spark suggestions for new reports, we do them and see what they come out to be. So we'll keep watching that, and we hope you keep visiting. Comment here, or feel free to get in touch any other way. In the meantime, thank you for watching. We'll see you tomorrow. Have a great afternoon.